Hello and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program that is designed to encourage a healthy living. I am Mary Joseph. Please do well to follow us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. As the world joined hands to mark this year's World Malaria Day with the theme Time to Deliver Zero Malaria, Invest, Innovate, and also Implement. It is a call for countries around the world to all come together under one umbrella to raise awareness about this vector-borne disease that has remained a significant public health threat and to promote efforts to combat it. Back in 2020, the World Health Organization estimates that about 241 million cases of malaria and about 627,000 malaria-related deaths do occur in 85 countries, and also more than two-thirds of these deaths were among children under the age of 5. They all live in Africa. It went further to say that about 29 countries are set to account for about 96% of malaria cases globally, and Nigeria also accounts for the highest malaria burden on the continent and also contributes to about 23% of malaria deaths worldwide, with a particular focus on the implementation of policies and strategies. This year's theme is tailored to reach marginalized communities, hampering on the fact that it is crucial to assess where we are as a country and what we all can do to accelerate progress towards a malaria-free Nigeria. Well, this and many more would be the crux of our discussion on today's episode of Wellbeing, but before then, let us quickly take this short break. We'll be right back.
Every day, we bring you up-to-date information on topical issues affecting the common Nigerian, from issues on politics,
Hello Nigeria, remain committed.
security, education, health, lifestyle, and so much more. Join Janice Kobum and Uyai Anyeken every weekday from 7 a.m. to 9 a.m. on Rise and Shine Daily, exclusive on Spectrum Television.
In recent decades, Africa is shaping its own destiny and should be referred to as the African opportunity. On Spotlight Africa, we paint the African picture the African way, laced with truth, detail, and the color of the African continent. Join Uyai Anyeken every Tuesday and Thursdays at 4:30 p.m. Spotlight Africa, telling the African story.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. So today we are actually talking about malaria, as we are actually celebrating with the rest of the world World Malaria Day, and it's good to have you join me on the program.
Yeah, thanks for having me.
All right, so malaria has been seen to be one of the most popular diseases around sub-Saharan Africa, and over the years we've seen so many cases, and we've also seen the challenges that it has posed in our health and also in our society. But why is that so? Why is this pathogen still here with us?
Well, malaria is endemic in various parts of Nigeria, various parts of Africa, and because of various factors, based on our level of development, I can put it at that level. When I say based on our level of development, there in the context of sometimes the way and lifestyle we handle things like our waste, our buildings. For instance, when we build the structures with which we build, how we build structures, various conflicts that generate displaces people and then causes, some challenges that result in people being exposed to, malaria, the vector of the disease, that's the female Anopheles mosquito. So there are a lot of factors that have contributed in making this particular disease to still remain amongst us, and those are the factors that you really have to address when you are trying to, get to zero levels of malaria, as is being celebrated in this year's World Malaria Day.
Okay, so every year the World Health Organization has hampered or we can properly eradicate malaria. But taking a look at our continent, the peculiarities of this region, how feasible do you think it is for us to actually achieve zero malaria?
Well, if you look at the African continent, some countries have achieved zero malaria, prevalence in the last few years. For instance, countries like Cape Verde, and neighboring countries like Cape Verde, have achieved zero malaria. Countries like Egypt is pushing to have zero malaria, within their cover. So I think that it's not something that is not achievable. In Nigeria, achieving zero figures based on the World Malaria report in 2022. In 2021, we had about 247 million cases of malaria globally. All right, and of that 247 million cases of malaria, 96% of the cases of malaria came from Africa. Now, Nigeria, you have Democratic Republic of Congo, you have Uganda, and then Mozambique contributing to the large pool of malaria figures we have. And this also, goes to the level of mortality as well. We are having almost close to 700,000 deaths from malaria, with 95% malaria, also from malaria. So it's whilst other countries are, driving away, going away from that narrative, we still have a lot. We actually are aware of. And I think that even though government is, spending a lot on preventive prevention and a lot of other, spending, we really need to do much more to actually reduce that prevalence of malaria.
All right. So taking a look at this year's theme, time to invest and also innovate, implement. There are so many things that are tied out to this year's theme, but can you tell us what exactly is the significance of this year's theme?
Okay, so this year's theme is drawing attention to the fact that we need to invest, we need to do much more than what we are doing now to get zero cases of malaria, and that will require us investing more, investing more in financially. The transmission of malaria, the burden of malaria is that by 2025, we should have reduced the total burden of malaria by 75%, and then by 2030, that burden should reduce by 90%. But with current funding that we are getting currently now, our current contribution that was got about $3.3 billion that was gotten, it falls short of the expected amount that is needed to fund for malaria and reduce that burden, and they actually meet that target. So it's calling on nations like Nigeria also to put in more resources into bridging that gap and reducing the burden of malaria within our affairs and globally as well. And then also, the team is looking at us innovating, to reduce the burden of malaria. So currently, we actually have innovations so that such as the use of the long-lasting insecticidal nets. All right. Now, the long-lasting insecticidal net is actually impregnated with pteroid, but we are actually saying that there's some form of resistance that has been coming over time with following the use of the net. All right. Now, that's one of the problems, apart from the fact that people collect these nets, and when they collect the nets, they keep the nets in their boxes, in their bags, and they never end up using the net. And they actually end up, so people actually misuse the net and use it to cover their farms, and so. But innovations are have been brought in. All right, these innovations have sought to combine pteroid with other chemicals that can be much more effective in killing the mosquitoes also. And then also there are policies that have been brought up to drive the use of preventive treatment for malaria amongst pregnant women, amongst school age children, and various groups in the north that have seasonal chemotherapy and all the rest like that. So, and then recently you're talking also, and then the one that was approved in Nigeria, the R21 vaccine that can be used for children to reduce the severity of malaria in children. Okay. All right. So those are some innovations that are coming in. In fact, I actually read somewhere about drugs that the Bill and Melinda Gates Foundation proposed that could actually be used, could be non-toxic to man when they consume it, but could be toxic to mosquitoes when mosquitoes end up sucking the blood or having the blood meal from people that have ingested that drug. So a lot of innovations are coming up, concerning malaria, but it's important that we begin to much more implement this process, much more educate, intensify surveillance for malaria, get involved in what is happening, and then malaria is not a problem that just government resolves. With the innovations that are coming out, meet us as a people ready to, apart from that, accept the innovations and then implement it amongst us, but also be ready to modify our lifestyle. Okay, so if you look at a state like Akwa Ibom, Akwa Ibom is a state that is bridging the gap between the urban and rural settings. So you are having a lot of people moving from rural areas to semi-urban areas and then urban areas. So with that kind of move, they are going to be staying in urban areas. So the drive of the world currently is how to prepare for this, because the transmission of malaria in urban areas are found to be slightly different from what you have in rural areas like that. So the people moving to the cities are likely going to want to go and build, and it's important that there's a lot of understanding with regards to proper town planning. All right, building of cities in such a way that when people come in, like I did mention earlier, we have challenges to create breeding sites for mosquitoes that end up, coming back into our houses as well. And then when you're also having people moving to cities like this, you're going to also combat the issue of waste disposal. All right, and then people dispose their waste indiscriminately. Now, this results in, again, breeding sites and breeding opportunities for mosquitoes to breed, and after breeding, to come back into the house and then bite and spread malaria amongst us. So there are a lot of other things, and then also modifications, people actually, trying to, change their health-seeking behaviors when it comes to malaria. People think that every other thing, for every fever that they have, the likelihood that it's going to be malaria. That's not true. All right. So people need to know that malaria is not sickness that we can just wake up in the morning and then, based on the fact that you have a headache, it happens. That not every fever is malaria. That fever can be something else, because we are currently talking about issues of resistance. All right, even though the lecture is pointing on the fact that there could be, issues of resistance, but we need to be aware of that fact that, when we discriminately abuse anti-malaria drugs, the risk of resistance from the drug, resistance occurs from that.
That brings me to the next question, in which malaria has actually been with us for centuries now, and in some families it has actually become a household name. So when you have any symptoms, maybe like fever or cold, you're actually going to go and self-medicate, and some persons even go as far as visiting traditional remedies to take care of themselves. Because to me, for us to actually achieve zero malaria, I think some of these issues need to be addressed.
Exactly. We just need to realize malaria in Nigeria and probably many parts of Africa has become something that has intermingled with our cultures. We can put it that way, because for every condition that comes in this country, we consider malaria first, and then they don't even use recommended drugs. Sometimes they use various remedies, and they go as far as using alternative methods to take care of themselves, like the use of enemas, positives. They use herbs, they use so many things in the course of trying to take care of themselves, and these things need to be addressed. We need to create the awareness, make people get to know that malaria is not a disease that you can actually play with, but also it's not a disease that you can actually start diagnosing on your own. You need to get tested, and then when you start the treatment, if you have malaria, you also need to complete the treatment, because a lot of people start the treatment and after a day or two, they just forget about it, they feel better, and they go on with their life, and then create gaps for resistance.
The federal government, the Federal Ministry of Health, has actually adopted this vaccine for it to be used. So for families who are actually hesitant to take their wards to go take up this vaccine, let us look at the efficacy of this vaccine. Is it safe? Is it healthy? Can we not see some of this, because we're going to eventually see some people who are going to be hesitant to go take up this, because we've also seen the COVID-19. So can you tell us, as public health consultants, how effective are these vaccines?
Okay, so like I did mention, the vaccines that are currently, I think they have gone into phase 3 or 4 trials, all right, and the WHO recommend they came up with the RTSS vaccine, which is said to have an efficacy of about 30-something%, that can rise to as high as 60% based on the what I saw. All right, then, but I'm told also that the federal government also adopted the one of the R2 Oxford vaccine, all right, which is said to have an efficacy of 75%. All right, even though that particular one from the federal government is still undergoing trial with WHO, and the WHO has not yet established it yet, but the federal government has approved that particular, has given a provisional approval for that particular R21 vaccine. So it's currently, it's not yet in use generally, but has been on trial, and it has been, people have been trying to look at it. But I think that it's going to be safe. Okay, it's going to be for children below the ages of 5, and the target is to reduce the severity of malaria in children, and in doing that, reduce morbidity and mortality. So there won't be any harm, all right, in taking the vaccine. But for now, we just have to wait, and when we get green light, there's a lot still going on in that particular area. So let's just keep our eyes, our fingers on the schedule of Nigeria.
Let's take a look at the role of individuals in the fight against malaria, because every time we actually push the blame to the government at various levels, but now let us look at the role of individuals to actually take precautionary measures to actually eradicate malaria.
Okay, so like I did say, individuals, the malaria is not the fight of the elimination of malaria within Nigeria. Is not the fight of the federal government alone. It's the fight of everyone must be on deck. Everybody's hands must be on deck to make sure malaria is eliminated within the shores of this country. At the same time, you have to prevent the disease as well whilst that fight is ongoing. So you want to ensure that you get the long-lasting insecticidal nets, and then you use the long-lasting insecticide, especially for pregnant women and children whose immunity, is still very low. All right, a lot of people get the nets, but like I said, using of the net is actually still very, very low. All right, so you want to ensure that simple practices like closing the door on time, all right, closing the door early, closing the windows on time, all right, are done. And then people, if you are going to stay outside, you use long clothing, all right, and socks that will reduce the bite or contact with the female Anopheles mosquito that transmits the disease. Also, people should they're keeping up things like stagnant water in tires, in containers should be discouraged. People should, as much as possible, drain this waters from containers and dispose of safely of these containers. Keeping vegetations, grasses around your neighborhood gives an opportunity for this, creates a breeding site for mosquitoes to grow around your neighborhood and eventually come back into your houses as well. All right, insecticides are used, but a lot of mosquitoes have already become resistant to many of these insecticides that are used. Or indoors, people evacuate their houses for a while and then they spray on the walls, and allow for a period of time before the families come back. It's said to be studies have shown, even though there are still one or two doubts here and there, that the study that indoor residual spraying is very, very effective. But a lot of people have done it and it has been shown to be effective. However, it's very expensive to carry out, and it's very, most people do not have alternative means of going to stay when you do indoor residual spraying. So it's something that is difficult to implement around here, even though they have tried that pilot in several parts of the country. All right, so we are left with the use of long-lasting insecticidal net, and then people have come up with other opportunities, other interventions like larvicide. All right, so individuals can actually be involved at that level as well, educating people, especially pregnant women, to take their IPTP drug. You need to take at least 3 doses before you give birth. So 3 to 4 doses before you give birth. So it's important. This is done, and then children are protected as well. Okay, you want to make sure the children get proper care, not herbs or all the rest when in case you have suspicions of malaria, because the timing for you to do those things may be so short, and it could actually be so short before your child could actually die. So it's important that individuals play critical roles to ensure that they prevent malaria and help to reduce the burden of the disease.
Taking a look at the implementing partners, because I must commend their efforts. Over the years, they have actually helped and also supported the federal government, state government, and also local government in terms of funding and also provision of healthcare equipment and also materials. So now, let us put our mind to the futuristic perspective. What if these partners are not there? What can the governments do to actually help and also control the fight against malaria?
Partners, it's a difficult question to answer, because we pray that we still have partnership. We hope we still keep our partners, because currently funding for health in Nigeria is very low, and look at our fiscal space for health. They just need to increase spending for health, because at the rates we are going right now, if partners pull out, we are actually faced with a lot of disaster. So, and then also you're already faced with healthcare workers, leaving the country as well. So it will be very poor and very terrible for you to have that kind of situation occurring. So, but for now, it will be very good for partners for the federal government, state government as well, down to local government, to increase spending on health to ensure that we still have all these commodities for use by pregnant women, especially children, and then of course other individuals as well.
Okay, so finally, now let us look at the feasibility of us as a country, Nigeria, to actually come down, maybe 3 steps lower in the rank when we talk about the prevalence of malaria in the continent. Nigeria is actually the top countries that is actually ranking the first when we talk about the prevalence of malaria.
Yeah.
What do you think we can do?
Yeah.
Do you think we can actually work together to actually achieve zero malaria free Nigeria before the 2030?
Okay, for now, we're actually there's some progress, but the progress is, like I said, very slow. 20%, and is down from 23%, which is just one step. All right. So for us to eliminate malaria and then start approaching zero levels, we should be talking about a prevalence that is low, less than 5%, down like that, which based on what you are seeing, from 22% down to 5 or so, higher than that, but over time it's reducing. So government should provide support, partners, individuals, the private sector, philanthropists. We should come on board. We should put hands together. All right. One of the issues why we are having this that if we put our hands together, if we work collectively, we can actually help. We can actually move in the right direction to reduce the prevalence of this deadly disease.
All right, thank you so much, Dr. Emmanuel Edward, for being a part of this conversation. And I do hope that before the year runs out and also before 2030, we'll actually work together to eradicate malaria from the continent. Thank you so much.
Thank you very much.
So that was Dr. Emmanuel Edward, the Chairman, Association of Public Health Physicians of Nigeria, Akwa Ibom State Branch. And we were talking about malaria, especially as we join hands with the rest of the world to mark this year homes from your community and also from the country. Thank you so much for being a part of the show. Remember that you could also be a part of the family by following us on all our social media handles at Spectrum TV, or you could visit our website at Spectrum TV to be a part of the family. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Do enjoy the rest of your day.